Afternoon, and thank you for joining our session today. Today we have Dr. Rita Daboul, consultant breast surgeon at Women and Children Medcare Hospitals in Dubai. Today we're going to be talking about breast lumps. I know that we've received a lot of questions and we will receive a lot of questions, so please start sending them now. Dr. Rita, how are you today?
I'm very well, thank you, Dalia.
Good.
Thank you for having me here today.
Thank you so much for your time today.
My pleasure.
Dr. Rita, let's start with the monthly lumps that we get during period time. Can you take us through?
Going through the monthly period, and they're not actually lumps. So what I tell my patients is that just before the period occurs, there's a change in the hormones, of course, that brings the period on. And those changes in the hormones makes the breast lumpy, but there's no actual lumps. So this is why I usually tell my patients that if they're going to examine their own breasts, and every woman should learn to examine her own breast to know what's normal for her, is to examine the breasts after the period. That's because before the period, they do get lumpy and tender and sore and swollen. So I actually show them when I'm examining a patient's breasts that when you examine a particular area of the breasts, especially what we call the upper outer quadrants, that area in particular becomes lumpy just before the period and tender. So when you're examining, you can feel these sort of, up and down type thing, but the whole area is the same. There's no actual round lump as such. So they are lumpy because of hormones, but there's no actual round lump.
Even the one that comes underneath the armpit?
Even the ones that are coming under the armpit. Usually if you're getting lumps under the armpit, there's an area there that's called accessory breast tissue. So there's two things that can happen under the armpit. One are the lymph nodes, but most of the time, the patients come to me thinking there's a lump there, but it's actually a lump in the skin.
Yeah.
Lymph nodes live quite deep in the armpit area, so by the time you can feel them, they're usually abnormal. But other lumps that can occur, they're like fatty lumps in the armpit, and you can actually see them, not just feel them. And those lumps are called accessory breast lumps. So there's a bit of excess breast tissue that occurs in the armpit area, and that can give you pain just like breast pain. At different types of different times in the month.
Okay.
Just before
So
the
this
period.
is something that I shouldn't freak out when we find it. Every month.
Absolutely not.
No.
Yeah, a lot of women think that's abnormal, but it is again a genetic condition, and some women have them on both sides, and some women have them just on one side. But it's completely benign. It's just a bit of excess breast tissue in the wrong area.
Doctor, how can we know that this lump is non-cancerous lump?
So it takes a lot of experience
From a person or
to tell whether something is cancerous or non-cancerous. This is why we tell all women, if you find a lump, if you're unsure, come and see your doctor and get examined properly. Now, sometimes we examine patients, most of the time, at least 80% of the time, we have an idea of what this lump is once we examine the lump. But also what gives us more information is, of course, imaging tests like, ultrasounds, mammograms, MRIs, and the shape of these lumps and how they look on these tests adds a lot of information to whether this lump is potentially cancerous or not.
Okay. And does it occur in a certain age, like so for teens, for example?
Correct. So younger women who are usually under 40 years of age are a lot less likely to have breast cancer.
Okay.
And over 40, women start to increase their risk of having more cancerous lumps. Having said that, it's a little bit different in the Middle East. We do see a lot more lumps in younger patients that could be cancerous, and this is why we're changing our recommendations a little bit to start screening a little bit younger. Yeah. So from about 30 years of age to do a yearly ultrasound is a good idea.
And is it a genetic lumps? So could babies born with it?
Usually, no, babies are not born with it. Occasionally you get a baby with a breast lump, but that's usually hormonal. Okay. And usually 2-3 months or so down the tracks, up to 6 months down the track, it goes away. So baby is just reacting to the mother's estrogen hormones. But most of it is not, the greater proportion of breast lumps are not genetic, let's say. It's more environmental. But a small percentage is genetic. Having said that, the benign breast conditions, so the non-cancerous breast lumps,
Yeah, I was about to
probably
come and
are
ask
genetic.
now, yeah, what kind of, what different kinds of lumps
So
are the
there's
breast lumps?
about, let me tell you, 10 different types of breast lumps that can
Okay.
occur. Thankfully, a lot of them are benign. But just for simplicity during the session, I'm going to concentrate on the commonest four. So there's a lot of cysts in a lot of women. So cysts are fluid-filled lumps, and they're completely benign, and most of the time they're harmless. They come and go during the cycle. In about 10% of women, there's something called fibrocystic disease or fibrocystic change. It's probably better to call it fibrocystic change because it's more a descriptive term than an actual disease. It's not really a disease. It's just that some women have this in their breasts, a lot of cysts.
Condition.
Yeah, it's just a condition. So it's completely benign. It does not increase your risk of breast cancer. But yeah, we see a lot of cysts on the ultrasound. When you do the ultrasound, it can cause lumps. And in some women, these cysts can get quite large, even almost as big as an implant. In some. But in most women, they're small cysts, and they just come and go with the cycle. So there's nothing to worry about those. Then you get the solid lumps. Okay, so the solid lumps, there's three commonest ones. So fibroadenomas is probably the commonest lump in women. Okay, it's benign. It feels like a marble, and it actually is. We call it the breast mouse because it's slippery when you try and feel for it. Okay. Even when you're trying to remove it, it really slips away from you. But it is solid and it's hard like a marble. If you go looking with an ultrasound, let's say we take 10 women off the street who have nothing wrong with them and do an ultrasound on them, quite a few of them will have these things called fibroadenomas. Some of them are so small that you cannot even feel by hand, but you'll see them on the ultrasound. They have a particular shape. We know that most likely these are fibroadenomas, and we just keep an eye on them usually. Other lumps, there's a lump that's very important to know about, and it's called a phyllodes tumor. And phyllodes tumor can be benign or cancerous or in the middle, okay? And it can mimic a fibroadenoma. So
but
what's
the middle condition? What is that?
It's phyllodes, but we call them, completely benign or borderline or malignant.
And when it's borderline, do you treat it as a cancerous lump?
Correct. Oh. Correct. Not with other treatments like chemo or anything, but with the surgery, you treat it different. So phyllodes can mimic a fibroadenoma. So this is why it's important to check, even with what we think might be benign lumps. It's important to check how they look on ultrasound and how they behave, if they grow quickly, or if they stay the same for a long period of time. It's very important to distinguish. And because they're treated differently. The surgery that you do for them is a little bit different. And then you've got your outright breast cancer, which again, you need to diagnose, and you need to diagnose them quickly and treat them quickly because it makes a big difference to the outcome.
Doctor, what should we tell the patients to prepare, or how to be prepared before going to screening?
So when we talk about screening, it means there's no lump.
Completely, right? We're just going for screening, our regular checkup, but still it's sometimes it's not irritating, but you feel exact anxiety. Oh, I'm going to do screening, what's going to happen, what they're going to do, how the checkup will go, and then the results, and how long would it take. They don't know, especially the first time.
Yes. So of course I would tell them to not be anxious. It's easier said than done. It is actually a fairly simple process. But for most women, it seems like it's like they're going through an exam. Not just a physical exam, but you're like sitting an examination and they're waiting for the result. Is it going to be pass or fail?
Exactly.
But it's easier said than done. It's a routine process. The greatest number of patients that come through come out with a benign result. Okay, so even when we're doing screening, most of them, 90% plus, won't have cancer. Okay, but we do it to pick up that little percentage. Because for them it makes a big difference,
Early treatment.
Correct. And when the incidence of breast cancer is now 1 in 8 women over their lifetime, it is quite a common disease, and it is easily treatable. And if it's diagnosed early, it is curable. So this is why I tell women to think of it as an appointment to get her hair done or her nails done. Just book in. Don't think too much about it. Get it done. At least once a year. And
at least once a year.
Yeah.
Okay.
The first time is difficult, but then if you're doing this regularly every year, it gets easier. You come in, you get your checkup, you're used to it.
Dresser, I love that.
That's right. That's right. This is what women do.
That's
They
nice,
get things
yeah.
done. Yeah.
To ease the process.
Absolutely, absolutely. Again, the unknown is scary.
Absolutely.
But
We've lived in it for the
That's
whole
right.
2020, the unknown.
and the more you practice, the
Yeah.
easier it becomes.
True.
So we encourage women to get more screening done.
Doctor,
Excuse me.
no worries. Is it a myth that birth control pills could cause breast lumps?
No, it's not. It's not a myth because it is. Remember, birth control pills do give estrogen and progesterone, and they are the female hormones that are in the system. So I see a lot of women that come to see me, who've in the last 2 months have had this breast pain that just won't go away. It's very annoying. It's scary. They're worried it might be cancer, and it's actually because they've just started on the oral contraceptive pill. And again, when they stop the oral contraceptive pill, the same thing happens when the hormones start going down. You're trying to get back to normal. Again, they experience this breast pain. Long term, though, over years, of course, it can produce lumps. Certainly, from the point of view of benign lumps, there's no real evidence to say that it contributes much. But certainly, from the point of view of breast cancer, it can feed breast cancer, let's say, or make a breast cancer start. But the risks of that are quite small. Usually, let's say you'd have to have a genetic preponderance to it, or you'd have to have a lump that's already started, and then the contraceptive pill has, encouraged it to grow more. So it wouldn't stop you from taking the contraceptive pill, that's for sure, because the risk is not that high. It's a small percentage.
Do you get men patients, not women?
Yes, but it is very rare still.
Okay.
So when we talk about breast lumps in general, remember we're talking about benign and cancerous lumps. So men get benign lumps as well. Okay, and usually men can get increased breast tissue formation.
Okay.
And medically speaking, it's called gynecomastia.
Okay.
And again, usually it's caused by hormones. A lot of the time it's from taking medication, during their like a cortisone type medications for bodybuilders. And that can produce breast tissue it can spark the growth of breast tissue in some men. And also, of course, if some men have a family history of breast cancer, a strong family history, they can get breast cancer as well. But it's a very small percentage.
The treatment for a breast lump would be what? Is it medication, antibiotics?
So it depends what's the cause. So we've gone through the causes. So I guess let's break it down into what type of lump it is. So if it's a cyst, inside it's fluid.
Yeah.
Now, if it's not doing anything, there's not much to do. If it's not causing a lump, if it's not causing pain, and if it's not infected, there's no need to treat. We can just watch.
Okay.
If it's a big cyst and giving you pain and symptoms or infected, we can we can empty the cyst under ultrasound with a needle. Okay, so it's very simple. You put a needle in.
It's not painful, the process of it?
Not painful at all. In fact, it relieves the pain. You put a needle in, you remove the fluid, and suddenly the lump is gone and the pain is gone.
Okay.
And the infection is gone sometimes if it's infected. So that's for the liquid or the cysts. For the solid lumps, the only way to get rid of a solid lump, of course, is surgery still.
The word that people don't like to hear.
So a benign lump, like a fibroadenoma, all you have to do is get in over the lump or near the lump and extract it.
Yeah.
And you only remove the lump. You don't have to remove any excessive tissue or anything, just the lump itself, because it's benign. With a phylloides, that's where the difference comes. If it's a phylloides, and I already said that a phylloides...
This is the liquid one?
No, the phylloides, remember I said it could be benign, borderline,
all right,
or
in
malignant.
between, right.
Yeah.
Okay.
So that lump, if you're going to remove a lump like that, thinking it's a phylloides, you have to remove it with an amount of normal tissue around it. You cannot focus on the lump itself, because if you remove just the lump, it has a high risk of regrowth.
So the breast shape and size would change?
That's right, depending. So if the lady has a large breast, it doesn't make a difference, depending on the size of the lump, of course. But a lady with small breasts, if she's got a big lump there, it can make a difference. Occasionally, you have to do a mastectomy for a phylloides tumor, unfortunately. And then there's your breast cancer, of course. So again, if it's a small breast cancer, you can do just a lumpectomy, what we call a lumpectomy, or removal. The better term than lumpectomy is wide excision. Okay, again, you have to take the lump with a normal amount of breast tissue around it to ensure it doesn't grow back in the same area. Now, when it comes to breast cancer, you have to actually treat the lymph nodes as well. And that's usually followed by some what we call adjuvant treatment, such as chemo, radio, or any other treatment, depending on the stage of where the cancer has presented.
Doctor, is it a genetic condition?
So breast cancer has a risk as a genetic condition of about 6%.
6%.
Again, the greatest number of breast cancer cases are environmentally caused and usually due to aging. The biggest cause is aging. So as women get older, they have an increased risk of having any cancer, right? But in women, one of the commonest cancers is breast.
Sure.
Okay. So aging is the biggest cause. Yes, there is a percentage of women that have a genetic cause. The difference between those who have a genetic history is that they do tend to present earlier. So women who have breast cancer, let's say under 50 or under 40, we go looking for whether there's a mutation whether they're carrying a gene mutation. If a woman in her 70s gets a breast cancer, usually it's age.
Doctor, can we avoid getting breast lumps, or is something that we can't avoid?
You cannot avoid getting.
We cannot. It's gonna come.
We wish I'd be very rich if I could find a cure for breast lumps that's non-surgical. So talking about fibroadenomas, remember I said quite a few women, if we took 10 women off the street, 60-70% of them will have these small things. Now usually they don't, not all fibroadenomas need surgery. Most of them will come up, they might stay stationary, they might not grow. And so the ones that don't grow, they don't need actual surgical removal. So it's not like every lump in the breast automatically we need to remove it. It doesn't work like that. So this is why you get assessed by a specialist, and based on how it looks, what we think it is, how it's behaving, then you decide whether this lump needs surgery or not. So not all lumps automatically equal surgery, but we check every lump out to ensure which ones need removal and which ones can stay, and we can watch them.
Doctor, one of the questions that we received is, what's the difference between a cyst in the breast or a lump in the breast?
So this is what I started.
Yeah, but for someone who can figure it out themselves before going to a doctor.
They won't be able to tell.
You can't.
No. Usually a cyst is softer than a lump.
Okay.
That's all I can say. A cyst usually is softer than a lump. There's a lot of cysts that you can't even feel. They're so soft you cannot even feel them. Whereas lumps, once they're over a centimeter or so, you can start to feel them in the breast. Again, it depends how big the breast is as well. Okay. But yeah, cysts are a lot softer, and usually you have to do an ultrasound to distinguish sometimes whether this is a lump or a cyst.
So we do ultrasound, we do screening, we do ultrasound, and then in some cases we do a biopsy.
Right. Before we get to the biopsy.
Before we get to the, okay.
Sometimes you have to do other tests like, MRIs or mammograms, depending on the age of the woman concerned. Yeah.
So if we are now down to the biopsy, how long does it take for the result to come out?
It usually actually takes about a week. It's, occasionally you can speed that up to about 3 days, but it is a long process, would you believe? You don't get an instant result anywhere. It does take time, first of all, from collecting the specimen, let's say, to sending it. That's the quick part. But once it hits the lab, they need to do quite a few stains and look at quite a few, of the slides. Sometimes they can't tell just from the first look, so they use extra stains. And from that, they might get a second opinion, for example. Takes time to type up the result, and then by the time it's sent, by the time it's signed off, the quickest is probably 3 days, and that's when you're really calling the lab all the time to try and get a result. And even then, it's a verbal result, not a written
Because
result.
it has to go back to the doctor, and the
Yeah.
results should be discussed with them directly.
Correct.
Mm.
So usually a biopsy result takes a week.
So another question goes back to the needle aspiration. Is it painful? How is the process? Are you do it in a clinic, or do you have to go to the hospital and get admitted for a day to do it?
No. It's a very simple process. So let's go through two types of biopsies. One, there's a fine needle, okay, and there's what we call a core biopsy, which is just a larger needle, literally. So when you're talking about the fine needle biopsy, I tell my patients that really it's like when you give blood. Because they all tell me, can I get local anesthetic for it? And I'm saying, well, do you get local anesthetic when you give blood? No. So it's the same needle that when instead of putting it, in here to take some blood, we're actually putting it in the breast. Of course, under ultrasound guidance, so we know that we're hitting the lump.
Yeah.
So it's a very simple process. It's an extremely low risk process. Of course, you'll feel the needle when it goes in, but that's it, that second that it goes in, just like when you give blood. After that, you get up, and you just got a little Band-Aid there, you go and do what you have to do. And but a lot of women, I find, they're really scared of the biopsy, mainly because they've heard somewhere along the line that doing a biopsy on a breast lump is going to make cancer worse if it's there. And I forever have to convince them that no, that's actually a myth, at least for breast lumps. Okay. We know that doing a biopsy on breast lumps does not worsen the scenario. Even if there's a breast cancer there, it's the only way, it's the best way and the quickest way to know that it's a breast cancer and to treat it. And it does not make it get worse.
Right.
Now, I think they've heard that about other cancers, and they cannot tell the person who spread the news about don't do biopsy.
It's definitely not a doctor to start with.
Exactly,
so.
and they couldn't tell the difference between a lump that was in the pancreas or a lump that was in the ovary or a lump that was in the breast. They just tell that it got worse.
It is a very sensitive topic already, going for a biopsy, so there's a lot of things in the head going on. Oh, it could be cancer. Oh, yes, I heard that this could happen. There's so many things, and again, we're not, the first thing that comes in mind, it's cancer.
Yeah, you just don't want it to be cancer. Of course, nobody wants it to be
Absolutely,
cancer.
Yes.
Even the doctors, when we're trying to prove this is not cancer. We don't want to have to tell anyone that they have that. So the next thing is the core biopsies. Yeah. The core biopsies, because it's a bigger needle, we do put local anesthetic in, of course, and that targets the slightly larger lumps just to get a better sample, and it's a more reliable result as well.
Doctor, we have a question here regarding breast lumps during breastfeeding. Is it something that we need to check with the doctor when we find it, or it's a normal thing that comes during breastfeeding time?
So definitely lumps that are anything. I tell my patients anything new in the breast that was not there before should be checked by a doctor. And that's not just lumps. I know today we're talking about lumps, but I tell my patients examine yourself every couple of months after the period. And yes, if you find a new lump, get it checked, but also skin changes, anything new, new nipple discharge, anything, new pain, anything should be checked. So during breastfeeding, yes, of course they get lumpy when in the first let's say 2 weeks of breastfeeding they get lumpy, but then they soften when you breastfeed, and then so any persistent lump that's there, especially a lump that's not getting smaller, not going away. A painful lump. Now, usually a painful lump is not cancer. Let's reassure women about that. But it still needs to be checked. So in most instances, pain in the breast is either hormonal or related to infection. Okay, so 98, 99% of the time, it's not cancer. And if there's cancer there, it's just what we call an incidental finding. So when someone has breast pain, we're not expecting to find a cancer. But we do the screening. Okay, because there could be something small there that we would miss if we didn't do the screening. So during breastfeeding, it's very common to get mastitis. And the first month, usually is the commonest time to get mastitis. The breast is not emptying properly. Parts of the breast. No, it's very painful and frustrating. The nipple gets quite macerated sometimes, and it's a painful condition. But it tends to settle down after the first month. Now, most lumps, thankfully, most lumps during that time are benign. Okay, and there are lumps called the galactoseals, all right, which are milk cysts that can happen during breastfeeding. They're not common, Okay, and obviously just infection. Mastitis is infection from breastfeeding milk that's not emptying properly and it gets infected and causes problems. But still, it needs to be checked properly.
Okay, but can you put them on antibiotics, or you
Yes,
don't recommend
yes.
antibiotics? You can.
So the treatment for mastitis, which is the run-of-the-mill mastitis, is related to bacterial infection. Then that's treated by antibiotics, and also by making sure that that milk that's sitting there gets emptied properly. Okay. By continuing to feed the baby sometimes, or
pumping.
Or pumping.
Yeah.
Or pumping. But not all breast infection is due to lactation. So some women can get the mastitis as well without being
And what's
lactation.
the cause?
It just comes up. Bacteria can go in through the nipple area and cause an infection, or a cyst. If someone has a cyst inside, there's bacteria inside of it. One day it overgrows and it causes an infection. So not all breast infections are related to lactation, but a lot of them are.
Doctor, we have a question on home screening. How can we do that?
Home screening?
The screening at home. How can we check? I think this is the question coming. How can we check the breast lumps or the breast if it's all good?
So we call it breast self-examination. Okay, which is what we recommend all women between your checkups.
Yeah.
So if we're doing yearly ultrasounds, let's say, of course a year is a long time and anything can happen. And this is why every woman should check her own breasts. Look, the best way, you can examine your breast standing up or looking in the mirror or in the shower. But really, if you find something, the best way to examine a breast is when you're lying on your back. And the breast is pressed against the chest wall. We tend to recommend examining the breast in a clockwise manner, going all around the breast, all the quadrants. Sometimes you massage the area to see, is there a lump there or not? And of course, the central bit. So after you finish going all around, the last bit to cover is the nipple area, to check if there's anything under the nipple as well. So we're feeling for lumps.
Okay.
And sometimes you can go up in the armpits as well.
And you do it every month, or you do it
every month is a bit, I believe,
much,
excessive,
huh? Okay.
And it borders on too anxious. It's good for women who do it, I mean, if they don't get anxious. But, usually we say every 2 months, so that we're not dwelling on it too much, but every now and again. We don't want to be obsessed, am I going to get breast cancer?
Every month? No.
No.
Doctor, thank you so much for the session today.
My pleasure.
And thank you so much for sharing your questions. I hope that we were able to answer most of them. We had today Dr. Rita Daboul, consultant breast surgeon at Medcare Women and Children in Dubai. Thank you so much, and see you in the next session. Take care.
Thank you, darling.
Thank you so much, Doctor.
Thank you.